Hello and welcome to Good Drugs. I'm Michael Fiedler, PhD, and I'm of the belief that in order to get through this thing called life, we need potions, elixirs, magic pills, and it's just a matter of finding good ones. And the good drug today is Rituxan or rituximab. Now, as the name indicates, this drug is a monoclonal antibody, and it targets a protein called CD20, which stands for cluster of differentiation 20. More about that later. So this drug is on the WHO's list of essential medicines, which are the most sort of safe and efficacious drugs out there. And it was first approved in 1997 for non-Hodgkin B-cell lymphoma, which is sort of in a class of blood cancers and leukemia. And it has since been approved for other forms of blood cancers. And the reason why it's used in these sort of oncology settings is because one of the initial observations with someone with cancer or these particular types of cancers is what's called lymphocytosis, which means you have a large number of lymphocytes, in this particular instance, B cells floating around in your bloodstream. And the reason why that's bad is you will likely have a sort of an abnormal cell type that has undergone some sort of mutation, which is what caused the lymphoma, and now they're mass replicating and they're potentially crowding out your healthy B cells or various lymphocytes. And so, what is a standard treatment for various cancers is chemotherapy, which will just knock out various cell types like lymphocytes. There's a lot of chemotherapy agents out there, but sometimes the chemotherapy doesn't work. And even if you wipe out a lot of cells, the cancer will persist and you won't hit it. And so Rituxan was approved to treat this area of high unmet need, or these sort of patients that were refractory or just didn't respond to chemotherapy of non-Hodgkin B-cell lymphoma, which was an orphan category at the time, which means there weren't any other treatment options for it. So when it was first born, it was a really impactful treatment for, leukemia, which is a really tricky condition, obviously. So let's talk a little bit about how it works. So what a CD20 is does not really that important. Just think of CD20 as a bumper sticker. And this bumper sticker is on B cells. And B cells are important in our body because they make antibodies. And those antibodies arm the immune system to recognize and fight pathogens. And so what Rituxan does is it finds all the cells in your bloodstream that have this CD20 and leads to their death through a process called ADCC, which is antibody-dependent cellular cytotoxicity, which is a mouthful, but it's essentially the touch of death. This um, Rituxan binds to CD20 and it triggers the subsequent cell death. And there are other mechanisms that are involved in the process, but suffice to say that's how it works. Um, it doesn't kill all B cells, or I should say, it doesn't kill all B cells in the B cell lineage. And if you think about the life cycle of a B cell like a bell curve, in the middle, the sort of like probably the 80 to 90% of the B cell's life, that middle meat and potatoes, is a traditional B cell that expresses CD20. But on the left and the right are older and younger cells that do not express CD20. And on the left-hand side, your pre-B cells, once they are sort of begin to go down their lineage from your bone marrow cells, don't express CD20 yet, but they ultimately do as they mature into B cells. And at the end of the B cell lineage are what are called plasma cells, which are carrying a specific antibody to sort of confer that adaptive immunity, and they stop expressing CD20. So the reason why I make this distinction is that Rituxan grabs onto and binds and kills that middle of the bell curve, that middle 80% or such, leaving the old and the young untouched. So what I mean by that is that you can still make B cells, and I should say that the process of B cell depletion by Rituxan happens fast. It's in a matter of days, and it lasts for quite some time. It takes upwards of a year for your B cells to come back to what they were before, sometimes longer, but you still retain the ability to do it. And in the case of these oncology situations, if you've got too many cells to begin with, maybe you could use some depletion. So that's why it's used and that's why it works in cancer. But it's oftentimes what happens when new drugs are discovered is that it opens up dimensions of medicine and research that hadn't been considered before. And Rituxan really um, sort of blew the doors off of B cells and antibodies and the role that they play in the human body. And antibodies are great. They are the artillery of the immune system. They're sort of what essentially confers immunity to viruses and pathogens and keeps us safe and healthy. But the problem is that things can go wrong and the body can or the body can result in the formation of autoantibodies where we're going after healthy tissue. And there are a lot, and those are called autoimmune conditions. And there are a lot of autoimmune conditions out there. And as Rituxan gained approval and was now an option for physicians, people started experimenting with it. And they thought, well, I have a condition like rheumatoid arthritis where I think that it's a secondary autoimmune condition or it's an autoimmune condition, and I would like to treat my patients who may be not responding to whatever the primary treatment option is. Maybe I'll try Rituxan. And the use of that is what's called off-label. And the use of Rituxan off-label is quite extensive, but it gives you an insight into what the drug can do. And with enough history, they have ultimately pushed to try to get approval, and they did for rheumatoid arthritis, and Rituxan is approved for rheumatoid arthritis. It's also approved and that was achieved in 2006. And there's two other indications for second. Rituxan has two other autoimmune indications, but they're hard to say. And one's sort of affects blood disorders, and one is a skin disorder. So the use of Rituxan in these autoimmune circumstances has sort of been a second act for Rituxan, but it isn't the end of the story. Rituxan continues to be used in a number of autoimmune conditions off-label, and these things include like systemic lupus erythematosus, which is kind of a broadband autoimmune condition. If you Google image it, you'll see things like like rash on your skin. It also can affect other tissues in the body. It can also be used for immune thrombocytopenia purpura, or ITP, which is a condition that results in low platelet counts. And so what Rituxan can do is eliminate the B cells and antibodies that would be driving the destruction of platelets. So essentially protect your platelets from being destroyed. It's also used to treat Epstein-Barr virus. And Epstein-Barr virus is the virus that causes mononucleosis, or mono. It's also it shows up in post-transplant situations with infection, and so Rituxan can be used to keep that virus under wraps because they think that the virus is housed in B cells and that's where it lives. Um, and there's another condition two other conditions one called NMOSD, which is neuromyelitis optica spectrum disorder, and myasthenia gravis, which is another tricky one. Both NMOSD and MG are thought to be, or at least in part, immune mediated. Aquaporin 4 in the case of NMOSD, and acetylcholine receptor in myasthenia gravis. And so Rituxan is oftentimes used there too, to sort of eliminate the cells that are making the antibodies. And another condition that is very near and dear to my heart that Rituxan was used in for a long time and really demonstrates how powerful it is, pushing decades since its initial approval, is multiple sclerosis. And it's been used off-label in MS for years and years and years. And so much so, and this kind of gives Rituxan its real value, or at least its real how impressive the molecule is 23 years after it was approved, is that you're getting biosimilars. And so there are two CD20 biosimilars on the market. One is called OCREVUS, which is also made by Roche Genentech, and ofatumumab, or Arzerra, which is made by Novartis. Ocrevus is has the MS indication, and that's where it's utilized. And Arzerra is used oftentimes in more cancer. It's indicated for sort of the cancer lineage of Rituxan. But Rituxan is the father of both. So if you are a drug that leads to biosimilars, you're definitely an impressive molecule. Now I shouldn't say that it's a benign molecule, because it's not. There are side effects of Rituxan, and they kind of fall in three buckets. One is oftentimes the case with any infused therapy, and I should say that Rituxan is an infused therapy. And it is given over a short course, and it just wipes out your B cells in a matter of days. And as I said, it takes a few months for them to come back. In that initial infusion, you can get a number of sort of allergic reactions, and it's not just indicative of Rituxan, you can get it to other infused therapies. And those are things like nausea, vomiting, fatigue, headache. So those are things that are going to happen in the short term when you first take the medication. Another safety signal that comes up with Rituxan is called viral reactivation. And essentially, what's going on there is because you're wiping out a lot of your adaptive immune system cells, these B cells, while you can make more, you may lose some of the immunity that you have conferred over your lifetime. So, if you've come across something like hepatitis B, for example, and have been able to, or have either cleared it or had a vaccine or had a immunity to it, you can get reactivation of that virus, and that's in the product label. So that's sort of something that is known about the fact that it is this immune depleter, and that'll actually come up later. And then the last thing that it's sort of the safety effect that it's worth calling out is it can lead to an opportunistic infection called progressive multifocal leukoencephalopathy, which is just a long, it's called PM, which is PML. And PML is a demyelinating virus. It basically eats your brain. It's pretty nasty. Um, but it tends to show up in people that are severely immune depleted. So I think it's been known for a while, but it first started showing up in clinics in some modicum of numbers with HIV. Um, it's just these huge strokes, what looked like a huge stroke on an MRI, and it turned out to be this demyelinating virus because these HIV patients had no immune cells. And keeping in mind that Rituxan is often used in conjunction with chemotherapy, you had cancer patients who got PML who were completely pulverized. Their immune system was completely pulverized. So it kind of makes sense that this would happen. But in isolation, Rituxan is relatively safe. The risk of PML is actually quite low, and it's the same thing with OCREVUS. It just doesn't show up as often as something like Tysabri, which is a potent immunosuppressive drug for MS, that you get a lot of cases of PML on that, even though it's still relatively rare, but it's more common with Tysabri than these CD20 drugs. So it it does have its hangups, definitely, but it is a really powerful drug, and not only from a medical standpoint, but from what it opened up in terms of research and sort of bringing it to where the Rituxan story is today. They think it's definitely relevant around COVID. Um, the viral reactivation is a real tricky point with in a situation like this. People that are on Rituxan for, let's say, rheumatoid arthritis, which isn't life-threatening, are holding back and being like, I don't know if maybe I need my B cells to kind of allow me to have protection against this virus. If I had COVID and I take Rituxan, do I now lose my immunity to it? So there's that issue. But then on the plus side, one of the big hangups with Rituxan is the fact, or sorry, one of the big one of the big hangups of COVID, I should say, is this cytokine storm that people are starting to appreciate, which is essentially you get infected with coronavirus, it sort of does its thing. It sort of comes and goes in terms of a virus, but it really knocks over a domino that leads to just a chaotic and spazzy immune system that has this storm of activity, this broadband autoimmunity that likely has an antibody component to it. So in the experimentation of what could be used to treat this cytokine storm, Rituxan has been inserted into the conversation. It's the risk benefit proposition isn't fully baked yet. This is obviously a really new situation, but it's been considered. In summation, this is a really amazing drug that has been on the market for 20 some odd years, and yeah, have always been really impressed by it. And I thought it was a good drug. And if you're interested in more good drugs, feel free to subscribe to my channel.